Hey everyone, this video is going to be an introduction to placenta previa, which is a kind of common test question. It's also can be encountered, in the clinic, in the OB/GYN clinic, that sort of thing, all obstetrics. Placenta previa means a low-lying placenta inside the uterus, or one that's close to the internal cervical os. So what does that mean? It means that the hole that the baby's got to come out through when it's vaginally delivered, there's a placenta in the way, some degree of placenta in the way. So here I'm going to draw from the side. Let's say we're looking at a uterus, right? And it's really big because there's a baby inside there. That picture is to scale, and that, anatomically correct fetus. And so this down here is this thick canal. Down here would be, your vagina. This is the cervix, and you have an internal os. Os just means opening. Internal os and external os. So we're going to be talking about this internal os here. Now, you probably know this, but in all pregnancies, in pregnancy, there's a placenta, right, which is kind of the connection. It's the start of that umbilical cord to the fetus. It's the connection to the mother's circulatory system. And it can be implanted, or it can be stuck anywhere here, right? So you can have like a placenta here, you can have a placenta here, you can have a placenta anywhere. Where you start to have potential problems is when that placenta is getting down, closer to this internal cervical os, right? Because this is the really entrance to that uterine cavity, and so if you have a placenta in the way, well, you might have problems with the blood exchange, you might have problems with the kiddo coming out, that sort of thing. Now there are 4 different grades, just for academic purposes, there are 4 different grades of placenta previa. Grade 1 is the placenta's down here, and they call it the lower uterine segment, or the lower part of the uterus, but it's not actually near this internal os. So like that would probably qualify as like having a placenta over here. And what does that mean? Well, it doesn't necessarily mean anything except we have to monitor it, make sure that everything goes well. So that's grade 1. Grade 2 is we're going to have a placenta that's getting closer to this internal os, this internal opening, but it's still not. We're still not actually touching it. It's just it's a higher risk than being further away. Grade 3, as you probably guessed, we now have actually contacted that cervical os, and we're partially covering it, right? So it's over it. It's partially covering it, but it's not fully occluded or fully blocking that cervical os. And grade 4, which is, I'm hesitant to use the word the worst kind, but is the most severe kind of placenta previa, is where you have that placenta, smack dab, just right over, the internal cervical os. So there's no way that kiddo could come out without having to go right through the placenta, which would not be a good thing. A lot of times, placenta previa is diagnosed around like 30 to 34 weeks, 32 weeks, with painless, bright red bleeding. Because that placenta is so close, there's vascularization. We don't know the exact, pathogenesis, but basically the blood from the placenta is going to start eking out of the cervix. So this woman's going to come in at 32 weeks with a normal pregnancy up to date, and she's going to say, well, I started bleeding. It's painless. It's bright red, which just for academic sake, that's kind of contrary to a placenta abruptio, or abruptive placenta, which is a different thing we'll have a different video about. But so it's painless, it's bright red blood, it's coming out around 32 weeks. That's kind of going to be your clinical picture of what a woman, pregnant mom with placenta previa is going to be going through. What conditions predispose you to this? Why is it that some women get this and some don't? The ones that have the highest odds ratio or are most correlated with having this are advanced maternal age, which means, if you have a mom that's older than 35 or 40, she has a higher risk of placenta previa. Someone who had a prior C-section or a prior placenta previa is going to have a higher risk of having another one, a recurrent one. Diagnosis for this sort of thing, if we use an ultrasound, an ultrasound transducer, looks and it sends out these sound waves, that's where you get those pictures of your kid. Well, it would also be able to tell you where your placenta is. So that's kind of like the confirmatory measure to make sure what's going on, why you have this bleeding placenta previa. That's going to be ultrasound's going to be able to see that. And then as far as treatment, the big thing, the take-home message is we want the mom to be safe and we want the fetus to be safe, right? That's the goal. So if you have like a grade 1 placenta previa and the placenta's way over here and there's a little bit of bleeding, but the mom's hemodynamically stable, which means she's not bleeding out, and the kid's doing fine, then we're just going to watch it and maybe, expectant management or watch and maybe consider delivering a little bit early. If you do have this grade 4 placenta previa down here right over that internal cervical os, C-section is definitely going to be on the table because, just think about a vaginal birth. There's just no way to get around that placenta previa. So that's placenta previa. Definitely I watch for it in older women, those who have had C-sections or previous placenta previas. Look for it. The classic test question is a 30-week unremarkable pregnancy that now has no pain, bright red vaginal bleeding. And that's placenta previa. Thank you.